The cannabinoid system is a system just like the respiratory system, the cardiovascular system, and the central nervous system. But the beauty of this new system is that it tries to keep all the systems together, what we call homeostasis. It keeps them in balance. Like if one of us out of balance, the cannabinoid system tries to put them together. We have receptors throughout the body, from the brain to your toes. The brain is the one that receives all the messages from your toe all the way to your brain. So it's important that if we're going to use medicines, they have to be able to penetrate the brain. And if you use oils, if you use any other compounds, they're too large to get into the system, and you're not going to get the best benefits. And I've been looking, I want a water-soluble compound that can penetrate all the cells in our body, including the brain. So if you have a water-soluble compound, you're going to be able to penetrate all the barriers, including the brain barriers. You're going to be able to penetrate the cells. By having maximum absorption, you're going to get better benefits. CBD oil is effective, but not to the level that I want. But the water-soluble compound, this is going to be like 100% absorbed. That means the benefits they're going to be great. I think both compounds of CBD and curcumin are awesome because both fight inflammation. So combining both products is going to be excellent. At the present time, BioRings are the most effective products that I've been using.
One of the most important things when we're looking at medications is crossing the blood-brain barrier. And why is that? Well, especially when we're talking about neuroinflammation. Neuroinflammation, or inflammation in general, we know is a cause of over 90% of diseases. So if a medication isn't penetrating the blood-brain barrier, or if we have to give large doses in order for it to penetrate, there's always going to be side effects, or the opposite, it's not going to work. So it's very important for it to cross the blood-brain barrier, especially if we're talking about neuroinflammation. When it comes down to these receptors in our brain, we talk about the CB1 and CB2 receptor. Well, some of those receptors are only in the brain. And if we can't get to the brain, in reality, or in vitro, CBD may work, but in vivo, meaning in reality, it won't. So crossing the blood-brain barrier is essential for many of these things that we're trying to treat, such that involve neuroinflammation. So my opinion with large doses of CBD, which can cause suppression of the endocannabinoid system, is something that we have to be careful with. And unfortunately, that's due to products being oil-based. It makes it very difficult to get the efficacy standard, right? So it's very important to start at a low dose. And not only is it important to start at a low dose, but to have a product that we can make consistent in its dosing. And that's where we're at right now in science. What are these consistent dosings of CBD? By making it a water-based product, it allows us to not saturate these receptors in the endocannabinoid system, therefore not only making it therapeutic, but using the minimal amount that's needed. So there are recent clinical trials with EEGs, which is a measurement of brain activity or how the medication crosses the blood-brain barrier, that are being investigated with oil-based products versus the water-based products. Unfortunately, the oil-based products were not shown to cross the blood-brain barrier. Now again, this can depend on the product or as well as the dosing. So that makes it very difficult. Now these are preliminary studies, but that makes it very difficult to say, hey, in reality, this oil-based CBD works for neuroinflammation. Again, the data is showing that the water-based product did cross the blood-brain barrier. And again, we measure this with the neuroactivity, which is promising for the improvement of CBD. Again, it's not so much that CBD is not good, but it's about making it better. Advancements, technology. Preliminary studies that were shown to me with the EEG studies showing that the CBD water crossed the blood-brain barrier within 5 minutes shows me that, again, this is bioavailable. It also shows me that if I'm trying to treat certain disorders, again, with neuroinflammation, that this is the type of product that we want to use. One that, again, will cross the blood-brain barrier, again, affecting those CB1, CB2 receptors, wherever they may be. Specifically in the brain, we need to pass that barrier. So that EEG study was important. And I think most companies should be put to that level, to that scrutiny, to say, hey, is this really doing what it says it does? There are side effects with CBD oil, and that should be known to patients. Unfortunately, it's readily available at gas stations and some other places, and oil-based products can have certain effects. So the BioRings products have been the most effective in terms of the supplements that I've seen with my patients. I'm a physician that doesn't push a certain product, so I like patients to try other things out. And for my feedback of patients, they've said, wow, not only does this work, but it's also easy to use. Again, one of the things that I like to do with my patients is mix it in their water and just drink it throughout the day to get that steady dose. So in terms of comparing other products, in my experience, it has been very effective and most effective when compared to other CBD products.